Hello, Mrs. Smith. I'm Dr. Jones, the stroke consultant that's on for today. Can you tell me what you've been told so far?
Oh, well, just that my husband David's had a stroke. I mean, he was fine a couple of hours ago, and then he just collapsed. I mean, we were having a late lunch when he came back from the golf.
Indeed, you're right. He has. He has had a stroke today, and it's a severe stroke, which is why he's not able to move the left-hand side of his body or speak. Okay? Now, this has been caused by a clot, which has either gone to one of the arteries or one of the veins in his brain. There is some treatment we would like to discuss with you. Okay?
Yeah.
Can I just check with you, Mrs. Smith? It's really important that we know exactly when these symptoms began.
Oh, it was definitely 2 o'clock, because I remember looking at the clock.
Okay. The reason it's so important that we know the onset of the time is that we may be able to give him some clot-busting drugs, which would reduce the effects of the stroke that he's had today.
All right, I'll take your advice on that.
It's important that we know, as I said, now, it's 2 hours since the onset of the symptoms, and the sooner we give him the treatment, the better the results. However, there are some potential problems with the therapy itself, which I'd like to explain to you.
What do you mean?
Well, if we give this treatment to your husband today, 1 in 10 patients make a good recovery. Okay? However, the treatment itself comes with complications, and 1 in 30 patients may develop one of these complications. And I need to stress to you the severity of some of these complications. There can be bleeding in the brain. Sometimes that can be very serious, and in some instances it can be fatal. So 1 in 30 patients who have this treatment may develop a complication, but we would recommend that your husband have this treatment today.
But he'll be all right, won't he?
As you know, he has had a serious stroke. Without treatment today, he may be left severely disabled or he may die. The treatment itself may help him, but I must emphasise that the treatment does have complications, which can also be serious. The treatment itself will help, but there are the complications to consider. And on balance today, Mrs. Smith, we would recommend that your husband have this treatment.
All right then. Thank you.
I understand this has been really hard for you today, for both you and your husband, and this has come out of the blue completely. I think the best course of action today is for us to go ahead with the clot-busting treatment, even with the risks of him having a bleed. For us to do that, we need to go as quickly as possible, because the sooner we start the treatment, the better the outcome. Would you agree to us giving the treatment to your husband today?
Yeah, you do whatever you think's best for him.
Okay. What I'll do is I'll go and speak to the nursing staff now, and we'll get the treatment started, and then I'll come back in and let you know how things are doing, and hopefully you'll be able to come in and see your husband.
Oh, okay then. Thanks.
Okay.